As you know, October is Breast Cancer Awareness Month, a good time for women and even men of all ages to take an active role in their breast health because cancer does not discriminate. Joining me this morning is Dr. Robert Gabordi. Good morning.
Good morning. Thanks for having me on.
Happy to have you on the show this morning. And again, I think there's a lot of attention in October, which there's good purpose for that, for breast cancer. But what is BayCare's role in this? And why is it that you guys wanted to really kind of get behind this and help spread, awareness about this?
Well, BayCare has just recently got out a new campaign really for women to take control of their health. You may have seen some photos going up around the community with women who are on billboards in the mall who have pink hands, and it's really designed to empower women to take control of their health.
And that's where it starts, right?
Exactly, and specifically in October we draw a lot of attention to breast cancer awareness. So, BayCare's role really is to try to get women to increase their education and awareness for breast cancer because it affects so many of us. And 1 out of 8 women is on average, which is 12.5% lifetime risk, which is a really amazing statistic. Yes, and there are women out there who are lower risk and women out there who are obviously going to be higher risk. And really our job is to try to figure out what your risk is and how to best screen you, and everyone's a little different.
Well, and I think what's so exciting about, and I would imagine you would agree as a doctor in today's age with this, is the technology is growing, really tremendously to where it doesn't have to be the death sentence that it was years ago.
Correct, and I think breast cancer in particular, one of the most amazing statistics is that early detection of breast cancer, not only does it save lives, but it also has an amazing survival rate when caught at an early stage. And so that's the whole idea behind mammography, is really to get in there, find cancer before it becomes a problem. You don't want to feel it. If you do, then that's why we tell women to do self-breast exams. We encourage them. They're going to know their bodies better than anyone else on the planet. And 3D mammography has really...
This is fascinating. We were talking about this before. Talk about why that's so important. I don't think a lot of women know that they have a choice to make sure to go somewhere that has that as an option of how they're tested.
Right, and not all imaging centers, unfortunately, are the same. One of the things that BayCare offers is this new 3D technology, and what it does, it's designed to really scan through the breast, and we've detected cancers that we wouldn't have otherwise detected with standard mammography, and it's really amazing technology.
The future of where this is headed.
And mammography is not perfect, but it's the best technology we have, and this is the best mammography that we have today. And so I encourage women, especially women who are younger or have a strong family history, dense breast tissue. Really, 3D mammography is a big deal for them.
One of the things I love about your campaign that you guys are doing is really celebrating survivors as well, and there's some pretty cool stories right here in the Bay Area.
That's right. This year alone, we've had some of the most amazing patients. That includes someone who's diagnosed at 24 years old, went through treatment. She's 25, has been a big, she's been all over the billboards in Tampa because the point is that it affects. It can affect young women too, and we typically think of breast cancer as happening women in their 50s, 60s, 70s, but standard mammography recommendations are, depending on who you listen to, 40, 45 as when you should get your first mammogram. We can't protect against those when they happen at 25, and that's why it's so important to know your body. So we have a 25-year-old, we've had a 90-year-old who was diagnosed with breast cancer, so extremes of age. We have a fitness instructor who's probably the healthiest person I know that was diagnosed with breast cancer and a male breast cancer. And really, I think that the thing to recognize is the fact that not only does it affect so many people, but it can affect men as well, so don't forget about the men, and it affects, really everyone.
Well, doctor, we have to wrap up now. Anyone wants to get a part of this, be a part of this campaign, what would you have them do as we close up?
So change your Facebooks, Instagram, Twitter pages to, paint your hands pink. You can find out more information about it on it'sinyourhands.org. Really just look at any of the BayCare websites. You'll see more about it. But encourage you to go out, get your mammogram, increase awareness and education, and save some lives.
Doctor, thank you so much for all that you do here in the community. Thanks to BayCare as well, and we look forward to having your team back.
Oh, thank you. Appreciate it.
We'll send it over to Sean.